still needs food. It's to make this information more. Oh, sorry about the sound, y'all. I think we got it fixed.
It should have changed over. It changed over
I
wrong.
hit the button and you said green, so it was green. So, okay, we're back. So, okay, I'm gonna answer questions. We're gonna get support as we eat our meals together. Oh, good. I got a thumbs up that we've got the sound back. So, what I was saying is it became very evident that there's not a lot of support for people in eating disorder recovery. It's a very secretive disease. It's a disease that a lot of people don't understand and don't feel comfortable talking about. And so when COVID hit, you didn't feel like you had enough support before COVID. And then I was hearing from a lot of people is it was like, we're struggling even more now. We don't have any support. And our meals are really hard for us because there's so much stress. There's so much anxiety. I recently did a couple interviews on the rise of eating disorders during the pandemic. So it is hard for people in recovery right now. And what's great about technology and all of us working from home is I was able to, I think, say, you know what, what can we do? How can we support some people? So I'm able to be in my home. I'm able to eat my lunch. I'm able to chill in my house and hang out with y'all. And we eat our snacks, we eat our meal once a week, and it's really fun. So I'm seeing some comments here on the screen. Please, if we're going to talk in the comments, I want everyone to support each other, but let's not discuss numbers. Let's not discuss calorie numbers, weight numbers, right? Let's not discuss behaviors. Don't use any detail. We want this to be a safe place for people in recovery. If you're thinking that something may be triggering, you can just add a trigger warning or a TW to your post. That gives some folks the idea of like, okay, I can keep, scrolling. I'm not going to look at this. So I'm also not going to diagnose anybody. Okay. I'm also not going to give any individual treatment advice. We're here just to kind of like hang out and support each other, right? So I see a question on the Instagram. Where are the comments? So my full video screen doesn't show up on the Instagram screen, but on YouTube, you'll see a little screen window with the comments from TikTok, because the TikTok folks love to ask a lot of questions and make comments. So, but Instagram, know that I can see your questions, and Facebook, I can see your questions too. So hopefully we're trying to pull everybody together so we're all here. We've got a few folks on Instagram, a few folks on Facebook, so we're all here together. So let's go back to, I see some, oh, it's Yom Kippur. So I want to say that I've talked with some people about this and the fasting and eating disorder recovery. And what I've heard, someone explained to me, their rabbi said for people in eating disorder recovery, fasting, the idea of fasting is to pull you closer, right? It's to bring you spiritually closer. And if fasting, because you're in eating disorder recovery, is going to pull you into your disorder and make you have symptoms and use behaviors, is that pulling you closer to your spiritual relationship, or is that pulling you further away? Most likely it's pulling you further away. And so they acknowledged, hey, that's not healthy. I'm going to say I'm not the expert on the Jewish religion or practices or beliefs. My knowledge is from very small conversations with people. So speak to your rabbi. If anybody's looking for a great like influencer to follow, Shira Rose, ShiraRose. She's on Instagram, and I believe her Instagram handle is at Shira Rose. I haven't seen her on TikTok, but y'all, when she joins the TikTok community, I'll let her know. But she speaks a lot about um, Judaism and eating disorder recovery. So that's a good resource for anybody. But is someone doing, okay, I'm just going and checking the Instagram. Is someone doing ESL? That would be amazing if I had access to that. No, I think you might be seeing if you're seeing hands moving, that's just me and my hands moving. It's not ESL, but I do wish I could do that. And I also wish that the technology would put the closed captioning on too. I know you can go in and add it yourself, but it would be great on these live videos if we had closed captioning too. Okay, so Kelly Doe trying to eat more snacks. Well, join us. Cheers. Whoever here is just hanging out eating with us, right? We got this. Really want to eat, you're hungry. Well, come on, it's okay. Listen, sometimes our brains are assholes, and if you have an eating disorder, you can guarantee your brain is an asshole at times, especially when it comes to food in your body. And I like to teach my clients to not listen to the asshole in our brain, because it just wants to hurt us and it's just worried about our demise. So can you ignore the asshole today, or at least do the opposite of what the asshole is telling you to do? So if the asshole is telling you to use behaviors, right, the exact opposite would be not doing that behavior. So it would be eating something if restriction, or it would be like not binge eating. So that would be like stopping when you're full, making sure. Can we talk about binge eating for a second? Let me take a little bite and then I want to make a comment. Okay. So there's a good question here on Instagram. I'll get to it. Um, binge eating. I get messages a lot from people. Hey, Stephanie, can you talk more about binge eating disorder? You talk a lot about restriction. It's also, I'm also a health at every size therapist, and I try to educate myself on like thin privilege and weight stigma. And I think what is happening in eating disorder recovery is it's a lot of thin people saying, hey, eat the donut, hey, eat. And yes, we want people to have permission to eat food. That does go for people who are in recovery from binge eating disorder. I think I hear they feel left out a lot because we're speaking to not restricting, right? All the time, all of us eating disorder folks were like, eat it, it's okay, it's okay, it's okay, because really, truly, it is okay, even for people who struggle with binge eating. We want to help you not restrict. We know that restriction really is a big factor for people binge eating. And so I want you to eat the donut if you struggle with binge eating disorder, because I want you to know you can eat that donut and there's absolutely no shame at all whatsoever for eating that donut or eating 2 donuts. How can you be kind to yourself and give yourself permission to eat food? That's literally what it's about. It's unconditional permission to eat food. And I know that sounds really scary. So when you binge, people who have binge eating disorder know that you can be included in conversations around restriction and giving yourself permission to eat food. Because when you can give yourself full permission to eat, right? The shame and the guilt and that spiral that causes us to want to keep eating and go into binge eating, the less shame we feel around eating, though, right, the less we're going to get stuck in that spiral. I'm also simplifying that process. It's not that people struggle with binge eating just because of restriction. I understand that there are a lot of factors that go into it, but I tend to treat binge eating disorder in my practice the same way that I treat anorexia in my practice. And so I want you to know that you are all included in these conversations and these discussions too. So the question on Instagram that I wanted to discuss, y'all have asked me a lot of questions. Let me find it. Is it okay to eat pretty quote unquote unhealthy foods if you're in recovery? You want to take care of your body, but sometimes all you can handle is French fries or ramen. Great. Eat French fries or ramen. I don't want intuitive eating is about not labeling food as healthy or unhealthy or good or bad. Are there some foods that perhaps provide nutrients in a different way? Sure. But sometimes French fries and ramen is all we can do because that's all our body is wanting or needing. And if you give yourself permission to eat that, your body's gonna change. It's gonna say, you know what, I'm wanting something else. So you're gonna notice your cravings may change. You're gonna notice like, oh, like I'm wanting a little bit more. This isn't tasting so great. This isn't so, I'm not enjoying this food. This food isn't easy for me to eat anymore. Well, let's add some variety. Let's change it up. Let's add something else. So I think that's how recovery is, right? It's just saying, okay, well, I'm going to eat this food and I feel comfortable with this food. Okay, well, now I'm going to add in another food because I'm kind of tired of eating this. So I'm going to get comfortable eating this food. And now I'm going to change it up, right? In that way, recovery can feel like it can last forever, but that doesn't mean that you're doing the hard recovery work, right? Maybe it just means that as you continue to live your life, when you're in a mentally, physically, emotionally healthy place, you still have permission to practice and add in different foods, right? You're allowed to keep exploring and trying different things. Well, because we just are going to get bored eating the same foods all the time. Okay, so let's see. Hi, friends. Okay, so saw your weight and you're upset and you're eating ramen, which is a fear food. So, like, that's a big deal, right? You're feeling triggered, you're feeling upset, and you're showing up for yourself. That is like, give yourself a pat on the back, round of applause. Everybody watching these, can we give a thumbs up? Like, way to go. Because there are so many comments, if y'all see somebody struggling, offer them support, right? Offer them a, hey, you got this, you can do this. I need a napkin. Michael, can you bring me a napkin? How do I deal with people trying to force me or shame me into eating because they want to help, but it's not helping? Wow. That's why family support or spouse support, like, that's why family therapy is really important in treatment, because our family needs to hear how they need to respond to us. They need to hear, what is helpful and what isn't helpful. Um, I think this is hard. If your family, it depends on how well you can communicate with them, but maybe it's telling them that, right? That when you say these things, it really doesn't make it any easier for me. Here's what I need to make it easier for me. But if there are any parents, support people watching this, don't force somebody to eat. When somebody has an eating disorder, they are legit very, very terrified of food. Their brain is freaking out. Their brain is not working in the way that we want it to be working, right? And so their body is truly fighting against them in that moment to eat that food. And if you're trying to force somebody, that only makes them more stressed and more anxious. Well, if they're already anxious and then we're adding, right, anxiety and stress on top of that to get them to force eat, that meal is not going to go very well. And so what we want to do when we're eating with somebody in recovery is try to give them a very supportive, loving space. Parents support, that may mean that we're sitting at the table for a really long time trying to get that meal completed. That may mean that we're putting things on hold to sit here with you because you're having a hard time eating a meal, right? And that feels really frustrating. We're busy people. They're very scared. They're very scared. It's like, so this is a terrible example because it in no way compares, but I hate spiders. I'm scared of them. I have legit arachnophobia. If you said, Stephanie, we're going to put you in a room with a spider, right? I would freak out. I couldn't do it. I would do everything in my power to not do it. But if you said to me, Stephanie, I'm going to sit here with you, I'm going to hold your hand, and we're going to get through this together, I would still be freaking out. But I would feel like, okay, I could sit here maybe and be exposed to this spider, right? So terrible example that is in no way a comparison to what recovery is like, but truly support, no, people are it's very, very scary. It's very scary to sit through a meal and get through a meal is truly a huge, huge victory. And it takes a tremendous amount of effort for somebody in recovery. So let's not make it stressful and hard. Let's make it supportive and loving and safe. Okay. You got a rough meal from your meal plan. You got a rough meal plan from your therapist. Advice on how I can start with it. Tell your therapist. First of all, hold on a second. Is your therapist also a dietitian? Or a registered dietitian or a certified eating disorder dietitian? It's very easy for people to think they know about nutrition and to put people on meal plans. The only people who should be putting somebody on a meal plan is a registered dietitian. If anybody ever says, here's a meal plan, here's what you should be eating, and they are not a registered dietitian, I wouldn't trust them. I'm sorry. And I'm sorry if people are watching this, if I'm going to get hate for that. But listen, like, you wouldn't go to the bone doctor for your heart issue. You know what I mean? And that doctor would say, I'm sorry, I can't help you. But we seem to think that we can talk about nutrition because we think that nutrition is easy. But nutrition isn't easy. I think my RD counterparts have to have master's degrees and they have to have like a bunch of clinical training, like a residency type situation. Like, they know food and they know nutrition. So I'm questioning, maybe it was your RD. It's also easy to get professionals confused. So I want to say that I don't think it I'm not coming at you, sorry. I'm coming at the fact that people want to make nutrition this thing that we can all prescribe when we shouldn't be prescribing it. And I see therapists do it. I know I was guilty of doing it back in the day when I thought nutrition was as simple as, you know, what MyFitnessPal and what, you know, you could Google online, those sorts of things, what we're taught in gym class, right? Nutrition is way more not that. So, let's see what other questions. Oh, here's some questions on people commenting on your food. So, we have to educate people in our lives. And I know that's really hard, but we have to set those boundaries and we have to tell people what triggers us and what feels harmful. They don't always know that. They can't assume it. So if somebody's making a comment after the fact, just do whatever you're gonna do. Get away, go take care of yourself, work through that anxiety, take some breaths, muster up the strength. Maybe you have to talk with a friend or a therapist or a coach or somebody in recovery. And then you sit that person down and you say, hey, when you make comments about my food, it triggers me. It makes me feel really anxious and it is not helpful. Can you please not make comments like that? Then the thing with boundaries, right, is we have to kind of say, like, if they continue, right, let's say you go to lunch again, they make a comment about your food. Hey, you know, we talked about that. That's that thing that bothers me, right? And then, you know, I'm sorry. If they change their behavior, great. But if they keep like having a hard time changing that behavior after you've set the boundary, we have to sometimes take that another step forward. And we have to say, listen, because you aren't respecting this boundary and you keep coming at me with this triggering information, I'm gonna have to, you know, we can't eat together anymore. I'm sorry, like, I know you're still my friend, but this is where maybe the line is drawn. Here's where you're not able to offer me support. And I know that takes time for you to figure out. That's fair, right? Take your time. I think that that's why you can talk about those things with somebody, right? That's why support is always such a helpful thing in recovery, is so you have somebody to run these things. What if it's somebody you live with? It is. Family can say, or roommates. God, I work with college athletes and I work with teenagers and adults, right? So I hear all the time it is shit from people in their home. I'm hearing so much from college roommates how y'all are triggering each other. Sometimes on purpose, I think, a little bit, because it's like a competitive thing and a petty thing, but sometimes it's totally unintentional, right? That somebody is triggering you. So I know there are traumas and abuse in households, okay? Talk to a school counselor, talk to a church counselor. There's free counseling. Open Path is a way to get free counseling, and talk to somebody and say, hey, the people in my house, they're saying these things to me. Help me. Like, help me talk to them. Help me, like, right? Help me. What are the words? What actions do I need to take? But it's okay to talk to somebody and ask for somebody to help you with that, because homes are abusive and parents can say really damaging things. Like this one, Madeline, I hope I'm saying that right. My mom is forcing me to weigh myself every couple of days and it can be triggering. Now, is that because we're monitoring weight for a reason? Because that's what the treatment team is needing? Barbara, I see your question on Facebook. I'll get to it next. Or is it like an obsessive thing? I'm usually a fan of, it's never a good idea to weigh ourselves. If it's like your treatment team that's wanting your weight, can they can they somehow help you with that and take that off of mom? If it's like in a mom obsessing thing, who can you talk to? Who can you say, hey, I need a therapist. My mom, I just need some help, right? I need to talk to somebody and I need help with an adult who's going to help me talk to my mom about these things, right? So a school counselor, somebody in a church, a coach, maybe like a friend's parents, again, a therapist if you have access to one, right? So I think it's using the adults in your life to help you talk to them, because I would love for you to do it, right? But if it's an abusive, even if it's not an abusive home, it's just hard to talk to our parents sometimes, isn't it? So Barbara's question is, how do you live with the extra weight? That is such a good question because it's so hard. It's so hard. In fact, so the Recovery Academy, shameless plug, according to RuPaul and Cody Rigsby from Peloton, everybody needs a shameless plug. So here's my shameless plug. I own also the Recovery Academy, which is an online eating disorder support community where you can learn about eating disorder recovery, and you're joining a support community of other people in recovery, and you get a lot of like hands-on support and information and tools and tricks and worksheets and things, right? So I lost where I was going with that. This is where I'm going with that, Barbara. Every month I give new content, which is like me kind of doing like a training teaching video where I teach you about a recovery topic, right? And I offer you worksheets and tips and tricks and tools. This is a hard one, accepting our weight in recovery. It's such a big one that the next content drop is going to be accepting our recovered weight, because it is really hard. It's really scary. And it can feel, because it's novel, right? I think it's hard for the brain. When the brain can't have an idea of something, it feels really overwhelming and it feels really scary, and that makes it feel like you can't do it. So I think you live with your body changing through recovery by learning how to be really kind and compassionate and understanding with yourself. Also, it is abandoning the idea that you have to love and or like your body. You don't have to like your body. You don't. I want that for you. I would love for someone to come to me and say, Stephanie, I love my body. Great. I want that to be something for you. But that doesn't have to be the goal. And that shouldn't be the goal. The goal should be, how can I just be kind to myself? How can I just not be such a dickhead? How can I just not call myself such horrible names and not make myself feel so ashamed all of the time, right? How can I just start to be respectful towards myself? Focusing on that, caring for the person that you are, right? Like the whole of who you are, instead of focusing on the weight, which is one tiny aspect of who you are. Great, it's a number on a scale, okay, but like there's so much other stuff about you. Like there's so many other things that you can accomplish, so many other things you can do, so many other things that you are. And so can you focus on that, right? Without, you don't have to like the number. You don't have to feel good about it. You just have to say that's a number, and all of these other things are also true about me. Could I please talk about how to go about getting a pre-authorization from insurance? Oh my God, I feel like I could do a whole lecture on that because I used to work for the insurance company. Doing authorization. Can the treatment people help you? Like, the insurance company is gonna want a lot of clinical information to make that decision. And so that might be hard for you to answer. So can the provider, someone from the treatment, they should be giving and doing that information. So put that on them. If for some reason you're having to do it on your own, I think it would be important to discuss the impact the eating disorder is having in your life. How you are not, because they're going to want to focus on like labs and the medical piece and weight and BMI. But how is this eating disorder affecting your ability to live your life and do the things you want to do, like go to school, hang out with friends, have a job, just like live, right? Um, I would try to talk to them about that. Can the insurance company see the effect that it's having on your functioning in life? How do I stop myself from overthinking what to eat and when to eat? That's an Instagram question, and that's a really good question. Can you make it more automated? Meaning, you're having to think a lot about food early in recovery, or like a relapse or setback in recovery. That can feel really hard, and I think the overthinking sometimes makes it easy to use behaviors. So how can it be, take out the thinking? Like, how can you maybe do a little bit of food preparation? Only meaning that you kind of know, right? Like, this is what I eat at the lunch meal. This is what I like to eat for my snacks, right? So you kind of have those foods ready-ish, available-ish, right? So you can more like grab it and eat it and go. I think sometimes when when eating is feeling really hard, it's okay to go back to a more like mechanical, more automated way of eating so that you just keep your body fed, right? Because keep in mind that stress and anxiety and depression in life, it can affect our appetite, right? So our body, our brain and our body aren't getting, like, we're hungry. Our bodies, we know biologically our bodies need to eat every 2 to 3-ish hours, really truly. Like, that's what, if we're up and going through the day, right? Our bodies need to stay fueled, our bodies need to stay fed. But like life and anxiety and things come up, and our appetite doesn't always get communicated to our brain. And so and food won't sound good all of the time in those cases. And so it's knowing I still need to eat something even though I'm not like feeling like I want to eat something, right? Even though it's not like I'm having a lot of weird thoughts, or I'm having a lot of like I just don't have an appetite, or nothing really sounds good. I still need to eat. So make it easy to just eat something. The food doesn't have to taste good. I'm eating a sandwich and chips, like boring. It's fine, but let's be honest, I would rather have had like, well, probably anything else for lunch. I probably would have loved to have eaten somewhere for lunch. I'm bougie like that, and I don't like cooking, so I would always take a meal out. I don't care where the meal is out to. Like, I just want to eat out so I don't have to cook. But I digress. Aw, so Emily Hawkins talking about eating disorder for the first time and the fear that you'll be perceived as weak or insecure. I took a big bite, Emily. You're not weak. You're not. And I'm going to make the assumption that you're sharing with somebody about your eating disorder because there's somebody that you love and somebody that you trust. And so they see you for a lot more strong and capable and awesome than you think you are, right? And so they might know you're struggling and might see you going through a hard time, and but they love you, all of you. So try to keep that in mind, that you're telling this person because they love you, and when someone loves you, they see you a lot better than you see yourself. And so it is not weak or insecure to talk to somebody. I understand that mental health stigma is a thing, but it is okay to be not okay. And if somebody shames you for what you feel and for having a mental health diagnosis or for having an eating disorder, they are an asshole. And you can tell them that Dr. Steph said so. They are an asshole, and they need to do some reading. They need to get some training. They need to learn how to not be such an asshole and how to support somebody when they come to you about something so serious. What are some signs of depression? That's a good question. Depression doesn't look like crying all the time. Depression is more... Okay, so a few years ago, y'all would probably not remember this. I'm old AF, so keep this in mind. Back in the 90s, probably, there was this commercial for Zoloft, and it was this little stick figure walking around, just walking around doing normal human things like all the other stick figures walking around doing normal things. Except this person had this rain cloud that just hovered above them and just dripped rain and drear over them. So no matter what they did, who they were with, it just felt heavy. It just felt like they were in this rain cloud, in this rainstorm. And I think that's what depression is it just zaps any joy. You can still laugh with friends, you can still go out and have a good time, but your spark is gone, your light is gone. Nothing feels joyful anymore. Nothing feels like passion anymore. Nothing is exciting. You don't want to do anything, yet you can still sometimes get out of bed. So you might feel really sad, but maybe you don't cry. Maybe you just feel like numb, blank, hollow, black, dark, like a black hole. Black. Maybe you feel angry, irritable, you're not sleeping, but you're exhausted and you just want to sleep all the time, but your sleep is shit. You're sore. Your body just feels like uncomfortable, right? Just like it feels like heavy. It feels like it's hard to move. It feels like it doesn't want to move. You're not eating, or you feel like you have a really increased appetite and you just can't like get that hunger satisfied. You're not wanting to like even getting up to shower feels hard. Who here's seen Euphoria? Raise your hand if you've seen Euphoria. Let's see. Okay. Who's seen Euphoria? Yes, right? Such a good show. Such a good show. So that episode or two where she's going through her depression and she's getting out of bed and she literally has to like pick her legs up and go to the bathroom. I thought that was a beautiful, realistic acknowledgement of what depression is like. It is hard to just literally get out of bed. Is it hard? No, like I can get out of bed, but I don't like your soul, your like life force doesn't want you to get out of bed. And without any soul and without any life force, we are just a bag of bones. And those bag of bones don't want to move if we aren't putting that like initiation into it. So, my friends, the volume may be low because I'm really bad at speaking into the microphone. Thank you for saying something. I'm going to work on that. All right, my last question is here on the screen. Put it there. From TikTok, I have a consultation tomorrow with an eating disorder therapist, and I'm scared. That's amazing. So I'm really proud of you. Congratulations. And it's okay to feel scary or to feel scared. if you are coming to see me, here's exactly how the first session goes down. You come in and I'm usually dressed super casual. I would put my feet up in the chair, kick my shoes off, take a drink of my water, and I would tell you a little bit about how I work, right? So whenever you see a therapist, there's usually like, they have to consent to medical treatment, and they have like their policies and procedures and billing. They kind of get all of that taken care of, and they want to make sure we're on the same page, because all therapy is it's a relationship, right? All my job is to just listen to you and create a space for you to feel comfortable to share. And as you share, because you're the expert on you, you know you better than anybody else. I don't know you, and that therapist doesn't know you. We do know a lot about eating disorders, and we do know a lot about mental health stuff, but we don't know you. So we listen to you, and we want to hear how you like think and move through the world and understand things and process things. And then we take what we learn about you and what we know about our training, and then we offer you information and we offer you feedback to help you make changes or gain awareness or grow and improve in some area, right? So that's all therapy is just building that relationship so that you can come in, share those things, and you and this therapist together can collaborate to make life easier, better, healthier, happier for you. That's what it is. So if anybody needs any help, if you want eating disorder recovery, like just community and support, and you're looking just like for things that you can learn and do on your own at home, if you're having a really hard time, maybe you don't have access to a therapist, check out recovery-academy.com. If you're wanting a therapist, go to psychologytoday.com. You can put in your zip code and bam, a whole bunch of therapists will show up there. And some will look if they are. You can even search for eating disorders specifically on Psychology Today. But that's a great place to start, right? Our Psychology Today, or Recovery-Academy if you're wanting just like information and tools for yourself. So my friends, I always say I need to spend more time with you guys because you ask such fun questions. Oh, I'm gonna take just a couple of minutes, okay, because I want to know something. So full disclosure, my partner is into tech, like and like production. So all of this that you see is because of him. He's amazing. But he has a way for, instead of, us typing in our questions here online, which is fun, you can call in. And who's seen like Frasier, right? Like Dr. Frasier show. If you could call in, would anybody be interested in that? Like if you could actually get me on the phone to ask your question. I want to just see how many yeses, if I would get any yeses for that. Who'd be down for that? Yes, yes, yes. Okay. Yes. That way you could hear like people's voices too. That'd be really fun, I think. So, okay. Well, we got some yeses here, so we're gonna, okay, I'll let y'all know when that's gonna be a thing. So for now, y'all, I have to say goodbye to go do the group for the Recovery Academy. So I am gonna go do that, but I will be back here on Monday, right, live 12:15-ish, and we'll hang out and chat and answer questions then. So y'all are so great. Thanks for being here. I'll see y'all. Bye.